Welcome to Sit and Stay, the podcast that breaks down the challenges of starting and maintaining a mental health practice into digestible chapters. Sit and Stay is presented by RipsyTech, an electronic health record company committed to addressing the mental health crisis in the United States.
Tom, good to see you again.
Parker, happy Monday. Hope you had a good weekend.
Happy Monday. So welcome back to the Sit and Stay podcast by RipsyTech. We, if you're watching on video, you can see this is a very special episode of the podcast. We have a guest here with us today. Tom, would you like to introduce everybody to our guest?
Yeah, we're very honored to have Dr. David Grunwald here on the RipsyTech podcast. And I've known David for many years, and beyond his impressive academic credentials, the main thing to know about David is he's just one of those super kind, nice people that you hope in the field of child psychiatry. This is the demeanor of all of your colleagues, but it actually happens to be somewhat rare. But I met David at teaching at Stanford, but David is a fellow Berkeley alumni like myself, go Bears. And then he went to medical school at UC San Francisco, a prestigious institution, and went to do his training in general psychiatric residency at Yale, and then came out to Stanford for his child psychiatry fellowship, which is where I got to know David. And David and two of the other in his group tended to be close, and we had lots of conversations and worked on some stuff together. And then David and I have another mutual friend and connection, and it's just been great to get to know David over the years. Since graduating fellowship in 2018, he's worked for San Francisco County, and I think it's fair to say that, like myself, David's very invested in those least fortunate in the world, and especially helping youth from impoverished backgrounds with mental health issues. But then I was super excited when David got the little entrepreneurial bug. I think maybe after seeing how things are done incorrectly in so many places, and David has taken the reins to start a business, and that's what we're going to talk to him mainly about. But David, it's great to have you on board. And what did I leave out in your background, or maybe I'll ask you to add a couple of things.
Well, thanks, Tom and Parker. Thanks, Tom, for that generous introduction. And thank you for inviting me to be here. It's an honor to be with you guys. You covered a lot. And I have, started this group with a couple of other colleagues and friends. Ishbala, Aparna Atluru, and also Karsten Heil. And we've all known each other in different stages of training and have different areas of expertise and skills. We're all psychiatrists, though, and we wanted to figure out how to get more access to quality mental health care for more people. We kind of had a little more time during the middle of the pandemic. I had started a private practice a few years earlier and had always wanted to figure out a way to be able to offer care to people with commercial insurance. Your Blue Shield, Blue Cross, Aetna, Cigna, and so forth. And as a early career psychiatrist, just getting started and trying to do a good job of just delivering good care, it seemed like too much to take that piece on when I started my private practice. But I always had the intent to offer care to a broader swath of the population, namely the middle class people who really get stuck without a lot of good care options in our current environment.
Yeah, no, and that's a great point that sometimes actually, you know, if you can pay cash, you can get good care. And if you're actually on Medi-Cal or sometimes if you're in the worst situations, one thing you can get is connected with behavioral health, but it's the people with their insurance cards that actually struggle the most to find anyone who can see them. And yeah, it'd be great. We'll jump into a little bit more on that also. And I wonder though, David, and something I don't know about you is like, how did you wind up choosing psychiatry and then more specifically child psychiatry? Like what was your journey through medical school, or when in your life did you figure out you wanted to work with kids?
Well, that's a question I could answer a lot of different ways because there's a lot of reasons I went into the field. But I was a psychology major at UC Berkeley. I always found learning about the brain, learning about personalities, learning about how people interact with each other and how people relate to each other. It's always been fascinating for me. And in undergrad, I didn't think I was necessarily going to go into the mental health field, but I just felt like it applied to whatever career I went into. And then I chose to go to medical school. And at first I thought I was going to go into primary care. I was always interested in prevention. And I did some violence prevention research, youth violence prevention, through UCSF. Actually, the med school program I was in was the joint program between UC Berkeley and UCSF. And as part of that program, we all did a master's thesis, and mine was on youth violence. Through my work in that program, which involved a few different areas that I went into. One was the cost analysis, and one was actually getting a grant to fund a supported employment program for kids. We actually teamed up with Friends of the Urban Forest in San Francisco, which is a gardening and tree and street sidewalk group. They do the majority of the street trees in San Francisco, and we created a program to get violently injured youth to learn about the skills and develop the skills to become arborists. Wow. So anyway, I got really interested in that work and curious about why. What are the causes of youth violence? What puts someone at risk? And the first study I was involved with this group, which was called the San Francisco Wraparound Project, which is still run through San Francisco General Hospital. One of the first studies, the results showed that the two most important factors for our clients to prevent recurrent violent injury is employment, being gainfully employed, and number two was mental health care. And working with these young folks, it became apparent that there was a lot of trauma in their lives. Certainly poverty played a role, and the associated many problems with poverty in our society, but also just not having access to care, and not having options to get outside of should say more dangerous parts of the community that many of these young people lived in, and to have options, the sort of employment options that people in the middle class and upper middle class and so forth have.
And did that, did you have an interest in psychiatry then when you were, did that develop because of this program and you learned pretty early in your medical school career that you thought this would be the fit for you?
Yeah, as I continued to learn in med school and got exposure to primary care and got exposure to psychiatry, and my mind started to change, and I started to become more. I still really respect primary care. It's a super important role that our primary care physicians play, but it just didn't feel like the right fit for me. And as I became more and more passionate about the work I was doing in violence prevention, I saw a role in that I could serve my community and some of the communities I worked with through the violence prevention group well as a mental health clinician.
Gotcha. Gotcha.
I also realized that the shorter visits with primary care just weren't really as a good a fit for me. I'm more of a person who really wants to talk and get to know a person to develop that deeper connection and to work. I really value the working with patients over a longer period of time. Not always necessary, but at times it is, and to get to know the whole family. Oftentimes, it's an important part of our work in child psychiatry, and something that I enjoy a lot.
Yeah, and Parker, we were just talking about that recently, I believe, about people going into this field to have more time with their patients and develop that relationship.
That's right.
All right, very good. And so did you, the next question we have is, and you mentioned you started a small private practice maybe right after you graduated, but when did you know that you wanted to create your own business?
Well, the private practice was a business that it's in it. It still is, and I still have that going on, but much less complicated than forming a group practice and negotiating with insurance companies and so forth, and all the operations and so forth. So, it didn't really occur to me until kind of early mid pandemic, when I had a little more time. I had been talking to these colleague friends that I mentioned, and we were talking about this problem of trying to provide a good quality private practice style care to people who have commercial insurance. And there were some other companies that were venture capital backed that were coming online, and I actually interviewed with one of them, and in my experience was that they weren't really set up for what we do in child psychiatry. That there were some good ideas, and it seemed like good reasons for these companies, but they didn't understand the complexity of what we do. And after learning a bit more about the other companies that were out there and talking to a few other people who had started similar companies, we felt that we wanted to form our own group to be able to offer both in-person and virtual care. This is when telehealth was becoming a lot more prevalent, and we our idea shifted slightly over time, but really to offer care for people with commercial insurance that's more affordable because their insurance would be covering it, more accessible, both because of the options of in-person or virtual care, and with the idea to eventually expand to cover more than just psychiatry, but we haven't gotten there yet.
Gotcha. And it'd be great to hear, like, in the process of starting the practice, like what that's been like for you. And so we had another guest on who did it all by themselves. And I like the idea that you have some colleagues and friends that have been doing it together. And I wonder, maybe you can comment both on what it's like having a group of you, which I could maybe see support, but maybe there's a lot of arguments behind the scenes, and just like, has it been exciting? Has it been painful? Both? Like, what has it been like to get this group started?
It's been a little bit of everything. There's been a lot of excitement, and I still get excited a lot of the time about the work we're doing and the possibilities. And since we've actually started seeing patients, it's exciting to know that we're providing a service that is helping people, and kind of going from an idea to an actual group practice that provides care for people and is working somewhat how we envisioned it. That's been really cool. Definitely there have been challenges along the way. There's been a ton of learning. I mean, I think I underestimated how much there was to learn about all these different pieces of running a business, but specifically working with insurance companies, working with people who specialize in billing, trying to coordinate everything, and trying to balance the influx of patients and referrals with the number of clinicians that we hire and want to have on staff. And all of this has been complex and interesting, and we're learning as we go.
And all of your group, I think you guys are all have other jobs also, which is a good strategy to keep other employment, especially while you're getting started. Do you see a point where are people planning to, if things really take off and David's company is called dia.health, but if things take off with dia.health, would everyone just move over full-time to dia.health? Do you think people will maintain other jobs as well?
That's a good question. For me personally, I wouldn't want to give up my job at the city and county of San Francisco. And in case anyone's listening from my city and county work, I'm not currently paid for my work at dia.health. It's all been a labor of love, and eventually that will be, as we develop this group more. But our clinicians are certainly, but that's a disclaimer I have to put out there because I haven't filed the paperwork for that. I have to
Gotcha.
file some paperwork through the city and county for having it. So this has been on my kind of extra time around the fringes. And that goes back to your question about working with others. I could not have done this myself. It was essential to have some really smart and skilled and driven partners to help in all the areas of starting and running a group practice. But I do think that certainly as dia grows, that we're going to have some folks who are going to be full-time, particularly kind of running the operations and the administrative pieces. The clinicians, we've tried to make it really also accessible and appealing to clinicians as well. And so we don't put a work requirement for our clinicians, but if and no one is working full time for DIA at this point, but if they want to, and we have the demand, which we're seeing the demand is continuing to grow, then they're welcome to work full time for us. But we haven't quite gotten there yet.
Gotcha. Yeah, no. So keeping a sort of flexible model like a lot of new companies do, where people could come work a few hours a week for you, or if they're really happy working there, and demand keeps going up, which in this field I'm sure it will, you wouldn't be opposed to having full-time clinicians with your group.
Definitely not. No, we'd encourage it.
Okay.
Yeah.
And it is a little, the other thing, Parker, about dia.health is it is somewhat rare for a small group to like already accept one major insurance carrier kind of right from launch. That and in fact, I usually even tell new young groups just start all cash up front and get a little experience with that before you even tackle insurance companies. But David and his group have tackled some of those headaches to get in network with Cigna, right, David?
That's correct, yeah.
Which is so great for anyone in the Bay Area or California that has that insurance and needs help for their kid. And I wonder, David, about why did you guys wait until you had feels like it was the plan from the start to get in network with at least one insurance before launching. Is that right?
Yeah, I mean that was the basis for starting this group, was to be able to find a way to provide good quality care for commercially insured people. And so we felt that, okay, we knew that it would be easier to get cash patients, from the get-go, and a lot less complex. And we do accept, fee for service cash patients. But we felt if we weren't able to offer commercial care for the commercially insured population, then there was no point in doing this group. And we plan to expand our, that's in the works, to expand our contracting with other insurers. We just want to get it right for Cigna first before we sign on contracts with others. And I'd have to say that Tom was a huge help in this process. Tom has been a mentor, someone who started a group practice himself and built that practice, and had so much experience and so much valuable information. We definitely are very appreciative of your support.
No, that's kind. And I think, and Parker certainly knows, like, anyone who's going to start a practice to help youth with mental health issues and like deal with the headaches of accepting commercial insurance, like the least I can do is lend whatever I can from my 17 years dealing with that. But no, it's great that you guys are doing that for our patients. Yeah, and now maybe, a little more sort of general or I don't know if I call them fun questions, maybe a little bit fun, but you're still an early career psychiatrist for another year, I think. I think you get your first 7 years out. They will consider you that.
Okay.
But now that you've been out 6 or 7 years from training, is there something you would change, like, about the mental health field if you could, or something about the state of mental health care in the US that you would change?
Well, it's nice to hear that I'm still considered young in some regards. Not hearing that as much these days. But yeah, there are a lot of things that I would love to see changed. And I think the the main thing that I'll talk about here is just that I'd like to see more accessibility to care, less barriers to care, and just I think there's well, first there aren't enough psychiatrists, there aren't enough mental health clinicians, and there certainly aren't enough child psychiatrists. This is something that's backed up by data. But on top of that, there's unnecessary barriers to getting the care to people. And those barriers come in many different forms. And some come in terms of financially and in terms of working with insurance companies, but some come in the form of stigma, or kind of cultural barriers, stereotypes. And I think we are making progress in all those areas. Maybe the managed care and insurance, we're not making as much progress, but it is good to see that there's more and more legislation that's at least being drafted to target this issue, and that there's more and more groups that at least are trying to tackle this issue. Some that provide more robust care than others.
Yeah, no, good comment. And I know I'm active with CSAP, California State Association of Psychiatrists. And David, I think you're active with the other legislative group in California, right?
Yeah, Cal ACAP. I've done a lot of work with them, and they are basically the political advocacy arm of California's child psychiatry group that's part of the national group, which is ACAP. So it's the state arm of our national, or bigger National Society of Child Psychiatrists.
Yeah, no, and California tends to be progressive on a lot of the legislation. And it's great that you're active in that as well. And it's been interesting to see what you can accomplish with legislation and what you still cannot accomplish with legislation.
Yeah. It's the long game, is what I've learned.
Right.
Yeah.
Right.
I have a question for David. When we interviewed Steve Kochi, I believe accessibility to mental health care was, the first thing that he brought up to that question as well. So, in that vein and how involved you are, I'm wondering this kind of hypothetical question, like if you had infinite money, infinite resources, like what would be the first thing that you would want to tackle with something like that?
Wow, that's good question. And I would say the first, I think, universal access to care. Not to say that universally everyone needs to see a mental health clinician, although I do believe that most people in this world could benefit from good psychotherapy, even if you're a generally well-functioning person. We can all serve to learn a little bit more about ourselves and learn about our strengths and challenges and how we interact with others. And we can all, myself included, build our skills in being a person and knowing about ourselves as individuals. But back to your question, I think so universal access would also include universal screening, something that could be done in schools across the country, just a baseline screener for every kid to see if there are any areas in terms of mental health, where that might be potentially worrisome, and to at least offer care. I don't think we want to force anyone to have care. And then to have a big enough workforce to provide that care, and then to be able to support the care needs from the less complicated cases to the more complicated cases. And that would require a coordinated team approach with a case manager or a role like that. So I think, that would be my moonshot.
Yeah, no, well said. I think David nailed it, actually, right? So having the care needed for everyone available and supply ready to provide it, that would be amazing. Yeah.
I think we would have if we had that, we would have a healthier society in general. We would have less polarization. We'd have people in general able to get along better with each other. We would have, everyone potentially having the skills to work out differences and arguments better. And I think that would make for a much healthier, place to live.
Yeah, that's how in one generation, you really wanted, like, the best shot at really fixing the world in one generation is get everyone who needs it a dedicated mental health professional. And, like, if you can working with kids, you see the trauma and past experiences of the parents pass on to the kids. And if we could just, for one generation, give everyone that support, I've always sort of fantasized like that's the fastest way to fix all the world's problems. But cool. Well, and David, is there anything you're really excited about in the mental health field right now?
Sure. Yeah, there's a lot of excitement going on in the field, and a lot of things that are inspiring and exciting to watch happen. And a lot has changed since I did my training, even. And we're seeing just a ton of innovation in terms of both psychotherapy and in terms of the medications we can offer. And in some cases, combining psychotherapy with medication. And this boom in psychedelic medications being used for treatment offers a lot of promise. There's also a lot of room for these medications to be studied more before we go and kind of make them more widely available, and particularly to children and adolescents. But there and there's a lot of growth in other areas. For example, dyadic care between a parent figure and a child. I've been watching that paradigm, that modality grow, and I've had some training in it myself. Family-based care, we're seeing innovation there. We're seeing kind of better understanding of what's needed in terms of wraparound care, which is wraparound care is the type of care needed for individuals and families with greater needs than your average family. And it involves, as I mentioned before, a case manager helping to coordinate the care across many different domains, such not just psychotherapy and someone providing medication management, but also in terms of other barriers that might be impacting a person, such as academic difficulties, providing tutoring support, housing support for people who are housing insecure, and many other resources. And that's actually the type of care I provide in my work for the city and county of San Francisco. Is I work for a clinic that provides wraparound care, and has been really inspiring and exciting to be a part of a team that offers a really robust type of care that I've seen with my own eyes many times. I don't want to use the word miracles, because it's not a miracle. It's just delivering the right resources in a coordinated way to people who need those resources.
Gotcha. Very good. Yeah. Well, and jumping back to dia.health, looking 5, 10, 20 years in the future, what would your dream be for your company?
Yeah, well, I would love to see dia continue to grow. I would like to have be able to hire more clinicians, and not just right now we provide care for all ages, but just psychiatry at this point. So we would like to be able to have case managers, as I had mentioned earlier, to have therapists and psychologists and other mental health clinicians to be able to join our team. And right now we're only offering care in the state of California, and we'd like to eventually grow and be able to provide care in other states as well.
Very good.
Yeah, and of course to be able to contract with all the major insurance carriers, so that anyone who has commercial insurance and wants to get care can get care at dia.
Very good. Yeah.
And I just wanted to ask a follow-up question. What advice would you offer to somebody who is thinking of starting their own group practice?
I would say make sure you have patience. I mean, patience in terms of the people needing care, but also patience in terms of being able to not think you're going to have this group start in the snap of a finger. It's taken a while in terms of the planning and execution along all the different stages. Make sure you have identified good mentorship. Someone such as Tom. I know you can't do it for the whole world, but again, we've been really fortunate to have your sage advice throughout this process, and I would say make sure you have. I want to bow down to Steve doing it himself, because I don't know how I could have approached this work without a team. So making sure you have I'm sure he doesn't do it all himself, so making sure you have team members who you can trust, who have skills in areas where you might not have skills that you've thought strategically about what you need in terms of what your skill set is and what skills you might lack, and what else would I tell others?
And the bow down to Steve was to Steve Kachi. And I think on reflecting that, Steve's spouse, Cynthia, actually has been there all the way and helped run the office, and she does an amazing newsletter and some of the admin stuff. So I think it's not purely solo. He does have someone to help with some of those other skills. Yeah.
Yeah. Well, yeah, that makes sense. So yeah, but it's let's see. It is something that we went in with a huge amount of excitement, and we still have a ton of excitement, but the ability to persevere despite some letdowns, not getting all the contracts we wanted to get, things taking longer than we thought it would, having to make some changes in terms of getting the administrative support we needed, and continuing to be flexible and to adapt to the challenges that have been thrown at us. So those are all things that someone starting a group practice should think about. And I would say, and this is partly why we're here talking, is that one challenge that we ran into early on was being able to keep good records, and also being able to bill accurately and efficiently. And we've been also very fortunate to have a partnership with RipsyTech, and we're just starting to get to know the product, but we've been really impressed, and we see how we can already tell how much it's going to simplify a lot of our processes, in terms of keeping good documentation, being able to manage employees, and being able to bill efficiently, which is a huge part of being able to run a group practice.
Thanks for that shout out. David's group is our RipsyTech clients. Other people are not, and we certainly didn't put David up to that, but we have a little we have put a lot of time and energy into the billing piece, and we've got a commercial coming out, and we feel like we're really trying to streamline that and make it as easy as possible for those clinicians who've decided, if you've decided to deal with insurance companies and trying to get reimbursement, at least let's try to make it so 98% of the time your payments and everything are just automatic and you don't need to worry about it. But David, your comments about having patience, CE, and being flexible and calm, and I've seen a lot of people who've sort of started, and more, some solo people who, after a few months and few frustrations, sort of hit a forget it point and just scrap their dreams of their clinic or their group. And I think David and his team, everyone seems very flexible and calm and well suited to bear with some of these setbacks that you'll face. And so those are important traits, and both in your psychiatrist in general, but also for persevering through the business. So we're super excited to see you guys take off and see your company grow. And it's such a good resource. And I think in David and his co-founders, when you see them talk about their company, there's a extra passion or sparkle in the eye that they're excited about it and dedicated to it, which is nice to see.
Yeah. Well, thanks, Tom. Yeah, like I said, it's been a labor of love. We're giving it the old college try, and when things get frustrating, it is really nice to have a group of colleagues that I'm been collaborating with who can kind of keep up the morale. We definitely have built a lot already. We have a lot of growth ahead of us that we hope for, But to kind of persevere through the bumps, it's been nice to have people who are, helping the whole team ride through those bumps.
Very good.
Yeah.
Parker, any final comments to add?
Not in particular, really. Just I kind of enjoyed kind of sitting back and getting to listen to this. I felt like I was, I just had a front row seat to a great interview. So I, loved listening to the both of you chat it out. So thanks for even letting me sit here and listen.
Well, you got a question in, and
yeah, a couple. Yeah.
Usually Parker has to be the workhorse keeping me on track, David. So I think he enjoys the couple sessions now where he's been able to just relax a little bit during instead of trying to rein me in for my tangents. But yeah.
Well, David, it's been great having you. We really appreciate it. I mean, like I said, it was great listening to the both of you chat over the course of this episode. So we really appreciate having you.
Thanks for having me on. It's been fun talking with you all, and some interesting questions to help me think back to kind of why did we start doing this in the first place. It's easy to lose perspective. You get so focused on the task at hand. So this was a treat.
Very good. And we'll get it's dia.health, and we'll get your website is dia.health.com. Is that right, David, or .org?
It's actually just dia.health.
Dia.health. That's easier. Good job. And we'll include information for your contact on the podcast when it comes out as well. And
awesome. Yeah, thanks. Well, I appreciate it, guys.
Yeah, have a good one. Appreciate it.
Okay. All right. Take care.
Bye.
Bye.
Thank you for tuning in to this week's episode of the Sit and Stay podcast. Until we meet again, we invite you to sit and stay with the ideas and stories shared today. Dive deeper into how RipsyTech can support your practice by visiting us at RipsyTech.com.